You are welcome once again to today's video. Now, today we are going to talk about a very common phenomenon that happens to everybody, whether you are an adult, you are a child, or you are a baby. It happens to everybody. And what we are going to talk about is hiccups. And at the end of this video, I expect that you learn what causes hiccups and how does it come about. And finally, we learn about how we can treat or prevent it from happening. Okay, if you are ready, let's get into the video. Now, the first one is, what is hiccup? Hiccup is repeated spasm or contraction of your diaphragm. Now, what is a diaphragm? Diaphragm is a muscle that separates the thoracic cavity from the abdominal cavity. And it is the muscle that helps you to respirate or to breathe in and breathe out. So without the diaphragm, that action will be impossible. Now, the question is, what is hiccups? Now, hiccups is a repeated spasm or contraction of your diaphragm paired with a hic sound from your vocal cord closing due to low levels of CO2 or carbon dioxide levels and irritated vagus and phrenic nerves of your body. Now, the phrenic nerve and then the vagus nerve are part of the respiratory system. Okay. Now, let's talk about the diaphragm. Now, what is the diaphragm? The diaphragm is a muscle that separates your thoracic cavity from your abdominal cavity. And it is also responsible for your respiration, your ability to breathe in and breathe out. And your vocal cord, in case you're able to speak, it is the help of your vocal cords that enables you to speak. Now, we are going to look at the causes of hiccup. Now, the exact cause is not known, but from experiences of people and from studies and research, it has been shown that eating and drinking too quickly can be a cause for hiccups, and eating too much can cause hiccups. Now, drinking carbonated beverages can also cause hiccups. Now, I actually experienced the carbonated beverages one recently myself. I woke up very early in the morning feeling so hungry. And I opened my fridge and realized that I had carbonated drink in my fridge. I took it, drank it. After about 15 minutes, I started having hiccups. That is where this particular topic came from. At first, I didn't know what topic to talk about. But as it happened to me, I decided to bring it up as a topic so that we discuss it. All right, so drinking carbonated beverages can also cause hiccups. Now, when you are stressed, either through anxiety or overexcitement, it can also lead to hiccups. Now, when you drink a very hot or a very cold drink, that can also give you hiccups. Now, there are some people that goes through chemotherapy. And those who undergo chemotherapy too, they experience hiccups. Now, you can leave in the comment section what you've done and that leads to you having a hiccup. This is not the full list of the causes of hiccups, but I want to keep this video very short. So you leave it in the comment section what you've done that made you have hiccups. Now, we can have a short hiccups which can get resolved by itself within a short period of time. After 1 hour, 30 minutes, it should get done. And there are some people too that have the persistent hiccups. What is the meaning of persistent hiccups? That means if it is more than 2 days, we say that this hiccup is persistent. Now, there are some people that can have what? Intractable hiccups. That means what? It is persistent within few months. Now, let's look at some types of hiccups. Now, there are some types of hiccup that happens to you and get resolved within few minutes of happening to you. Now, that's number one. Number two, is a type of hiccup that can persist for some days. Like if it persists for more than 2 days, we say it's what? It is a persistent hiccup. You know, there are also some people who have hiccups that can persist for few months. And that kind of people is what we call the intractable hiccup. We can say that someone is suffering from intractable hiccup if the hiccup is not resolving after some few months. And that can be because of a disease underlying the hiccup. It's not just the physiological hiccup that almost everybody has. That means that there can be problems that the person is suffering from. That's the reason why the hiccup is not getting resolved within a few short period of time. The hiccup can be long. That is when we say what? The intractable hiccup can be caused by 1, cancer or tumor, respiratory disease, or disease of the nervous system. And this is not the full list. In case you also learn somewhere of the causes of long hiccups, feel free to leave it in the comments. In case you don't understand something here, also feel free to Google search all the information I'm giving you right now. Now let's look at how we can prevent it. That's the most important aspect of the video. Right now we know what is hiccups, but how can we prevent it? Or what can we do at home to prevent hiccups? You know, these are all things that can be done in the house. There's no research that shows that they're effective, but there's no harm in trying. And as for there's a substance I know that can solve it quickly, and I'm going to tell you at the end of the video. Okay, so the number one thing you can do in case you're having hiccup is to drink water. And there are some people who they gently pull out their tongue and also help stop their hiccups. And some people gargling water helps in stopping hiccups for them. And then breathing into a paper bag, not plastic, a paper bag. All right, and this particular substance I was telling you about, it is called magnesium. How does magnesium help in this particular case? The contraction of the diaphragm or spasm of the diaphragm is what leads to hiccups. All right, now if you can get in a substance that will help stabilize or stop the contraction of the muscles of the diaphragm, we can stop hiccups. That is when magnesium can be used. Magnesium can be used. Magnesium is one of those substances that helps in reducing the contraction of the muscles, and it helps in stopping the hiccups. Now, in case all of these natural methods of treating the hiccup does not work for you, and it is still long hiccups for few months, you are still undergoing hiccup or hiccuping. Even, you know, the longest hiccup that was experienced was for 60 years. 60 years. Can you imagine that someone was hiccuping for 60 good years? That's the longest that ever recorded. Now, in case that is happening to you, there are medications that can be taken for those long hiccups. Number 1 is what? Gabapentin. And number 2 is baclofen. And the final one, we can use chlorpromazine. Now, what I'm trying to say is, in case you are sick of long hiccups, you are trying all this method, it's not working, kindly visit the hospital. What the video I'm doing is just for awareness purposes. You become aware and know more of yourself. You know, I'm really surprised of the fact that you know the vehicle you drive better than your body, which must be a sin. Your body, you must know your body more than you know anything else, because that is you. But in reality, it is the reverse. People know their cars, people know their shoes, people know their whatever more than their body. And that is the mission of this channel, so that we help you know yourself more. All right, this is what I have for you in this particular episode. And in case you like that, I would like you to subscribe to the channel and be a part of the family. And remember to share the video and let your loved ones also benefit from this message. And remember to subscribe to the channel. I hope to see you in another one. Thank you so much for watching.